got the spectrum.
I think we're good.
You good? Okay.
Yeah.
All right. Good afternoon. Thank you for being here today. I am Kristen Foreman, the proud principal of Sherman Middle School, and I want to thank you for coming to our school community today. We have a wonderful, diverse, engaged, and talented group of students here at Sherman, and we're working hard every day to support them in their learning. Over the past year, we've been able to take advantage of the Building Bridges program at our school to provide the coordinated, proactive services that are sometimes needed to fully support a student and ensure that they come to school to learn. It's been a valuable program for us here at Sherman. And to tell you more about the future of the program, I am pleased to introduce and welcome to Sherman County Executive, Mr. Joe Parisi.
Thank you so much. Thank you, Principal Foreman. We really appreciate being able to use the school today. Before I begin, I'd like to tell folks who I have up here with me today, and hopefully I get everyone. From Catholic Charities, we have Jackson founder Geraldine Robinson and Kathy Stelrick. We have Bonnie Laughran, who is the Executive Director of NAMI, Dane County. From the Middleton Cross Plains Area School District, we have Don Johnson and Jerry Nicholson. And we have Mark Elworthy, who is here with us from the Wisconsin Heights School District. And we have MMSD Superintendent Jen Cheatham with us today, too. And after I speak, Superintendent Cheatham will come up and say a few words. And then everyone here will be available for any questions folks have afterwards. Did I miss anyone? All right. It's a good start. Take that one and put it down here. Oops, one down. Excuse me.
There you go.
They saw that, but no one else did. Right. Well, we're here today to announce a major budget initiative for the 2016 Dane County budget, which will be formally introduced on October 1st. About 2 years ago, we developed a pilot program to address mental health challenges experienced by children in our schools. The original idea for this came out of many conversations we had throughout the country, one in particular that I had with members of our Joining Forces for Families team in Verona. Joining Forces for Family is a county approach to delivering social services, a decentralized approach in which we gather partners in the community. We have offices in communities throughout Dane County, and we work with the local schools. We work with law enforcement, school staff, and other nonprofits to bring our resources together and align our services and do what we can to help people who are facing challenges in the community. What was brought to my attention then by both law enforcement and school staff was the growing challenge that is faced in classrooms with young people who are having mental health challenges, and particularly when those challenges rise to crisis level. Not only is it a challenge and a crisis for the young person who's experiencing it, but what happened and still happens too often is that school staff sometimes feels they have nowhere to turn other than law enforcement. It puts law enforcement in a challenging situation, puts school staff, and of course it puts the young person and their family in a challenging situation. So what we decided to do was create a pilot program in which we would form what we refer to as mental health crisis teams who could be available for school staff when a mental health crisis arises in the classroom or in the school. This is a team people can call in to work to de-escalate a situation, to help get the young person connected to the services they need so they can get the help that they need, and to do so with this least disruption in the learning environment for everyone involved, and perhaps most importantly, to help keep the young person from having to enter the criminal justice system and involving law enforcement. These teams were originally built and piloted for Verona and Sun Prairie, and with the help of County Supervisor Carousel Baird, we were able to also begin a pilot program in the City of Madison schools. Well, the pilots were an overwhelming success. And Jen, I was going to ask you, are you going to mention any statistics, or should I talk about those?
I'm getting the statistics.
Okay, so what we did is we surveyed staff in the schools that had these teams. And in the Madison School District, 94% of staff surveyed noticed improved behavior after the program. 87% of staff said there was a decrease in office discipline referrals or suspensions, and 93% of Madison school staff noted a decrease in high-risk behavior in the classroom as a result of the Building Bridges program, which is what we call our mental health teams. You know, recently the Dane County Youth Assessment surveyed students across Dane County and found that 38% of high school students surveyed reported having long-term emotional or mental health issues, including depression, anxiety, and eating disorder or other mental health problems. There's clearly a need in our community, and particularly for our young people, for us to step up to the plate and provide the services that they and their families need so that they can remain healthy and have positive experiences and thrive in life. So due to the effectiveness of this pilot program and of these teams, my 2016 budget will expand the reach of the mental health crisis teams, the Building Bridges program, to include all Madison K through 8 schools and 2 additional suburban districts, bringing the total to now all across Madison Metropolitan School District and 4 suburban school districts. This is a big deal, and it's only made possible because of a willingness between the county and the folks who are standing here with me today to forge partnerships, to pool our resources and expertise to ensure that the most effective use of each entity's limited but crucial resources are brought together. When different entities come together toward a common goal, the well-being of our children, we are able to make a real difference in people's lives. I'd like to thank Superintendent Cheatham and the other Dane County school superintendents for their leadership, for their spirit of cooperation, and their inspiration and can-do attitude. And I'd like to thank county staff and Catholic Charities for all of the hard work they've done to bring this program together. This is how government's supposed to work. And it's a great example of what can be accomplished when people come together, when we come together as a community to address our community's most pressing needs. And in this case, it's the needs of children and families with mental health challenges. So again, I'd like to thank everyone who's up here with me today. We're looking very forward to expanding this program throughout the Madison School District and expanding it to 2 more suburban districts for a total of 4. And next we're going to hear from one of our partners, Madison Metropolitan School District Superintendent Jen Cheatham.
All right, thank you. Thanks, Joe.
Thank you for joining us today. I want to thank Principal Kristen Foreman for hosting us at Sherman, and I want to thank the County Executive, Joe Parisi, for his leadership, and as he mentioned, the collaborative efforts between the county office staff and our team here in MMSD, all aimed at expanding mental health services for students and families. In our school district, as you know, we're working hard to stay incredibly focused on the day-to-day work of teaching and learning in each of our schools. And we know that when children come to school, both physically and mentally healthy, they're more capable of fully engaging and benefiting from what happens during the school day. And we're doing a lot on our end to make sure that our environment supports students in every possible way, but also when it comes to mental health. Over the last several years, we've put into place a curriculum, kindergarten through 8th grade, that focuses on building student social emotional skills. We've provided professional development for our staff on mental health issues, including trauma-informed care. And we're also piloting the full integration of direct mental health services in several of our schools. But even with those efforts, we know that there are needs as a school district that cannot be met by our efforts alone, and we need the kind of partnership that you're hearing about today. Over the past year, Building Bridges has helped us serve our students and our families in the East Feeder Elementary and Middle Schools. As Joe mentioned, we've learned a lot from that pilot, but mainly that it's having a positive effect on children and their experience in classrooms. It has provided proactive, individualized support for students who need short-term stabilization and additional services that the school district can't provide on its own. Through this partnership, we've been able to provide wraparound case management for children, connecting them and their families to the services that they need to be successful. And of course, this results in not only students being able to engage in class more, but it supports our staff as well. Thanks again to the leadership of our county executive. I also want to thank our school board, because this is really a collaborative effort, not just devising the kind of services our students need, but investing in the kind of resources that are necessary to make that happen. Because of this investment of both the county executive and our school board, we are going to be able to expand our services. We will now have 3 of the 4 teams that we think are necessary for full implementation. those 3 teams will be able to serve all of the schools in our district. But we really need one more team, so we have a little more of a stretch to go before we can say that we're truly meeting every child's needs in Madison. But I know that we'll stay on track because the commitment is there. The investment in providing mental health services is something that we all recognize. Again, for teachers to stay focused on the day-to-day work of teaching and learning in classrooms, we know that their needs cannot be addressed alone, and this coordinated effort is necessary for our students to thrive. Thank you. And thank you, Joe. Oh, that's mine. I'm leaving pieces of paper
That's all
around,
right.
too.
Thanks, Jen. Again, we're really excited about what can happen when people come together focused on a common goal, and in this case, the well-being of our children. And these mental health teams are going to be effective not only in times of crises, but for getting in there before crises and helping kids get what they need and get connected to the services that are available and that will really make a difference in people's lives. So I'm excited about just being able to move forward with something in such a positive manner and coming together with so many good partners for the betterment of our community. Would be happy to answer any questions you might have.
So there is going to be, how many teams are there now?
There's one in MMSD, and then there's one in Verona and one in some Prairie. So this will create an additional 2 in MMSD, correct?
Yeah.
And then 2 more for suburban districts who will be able to compete in an RFP process.
That's right.
So,
So there's going to be 4 more master level mental health professionals?
yeah, and the reason this is able to work is because we're partnering on the effort. We're bringing money to the game, the school district's bringing money to the game, and there are other school districts who have brought forth a desire to partner with us financially too. Because as we know, there's a lot of need in our community on many levels, and there's always much more than any one entity can take on by itself, be it the county, the city, the school district. But when we focus our resources and partner, we can accomplish great things. And this program is really a good example of the positive results you can get when you do team up your resources and focus them where they're needed the most.
So are there teachers or other staff that kind of reach out to this program for students? Is that how it works?
That's the way it works. Kristen, do
Do you want to talk about your
Sure.
experience with it?
We actually, in our building, all buildings have a student support systems team that works with students. And it's wonderful because building bridges is just another resource we can use to help us when we need that help. Also, it's very important that we do have a counselor, social worker, psychologists in the building also that are very imperative to our system to help support those students along with building bridges.
So those people in the schools would make the connection?
Yes, most definitely, they make the connection.
Do you see, how often do you see things in school? How often, what kind of need are you seeing?
Wow. A huge need. That's why it's wonderful that this is happening, because this is something that's not happening in every district. Realizing that the whole child needs support, not just the academic part, but also dealing with the mental health. So there's quite a bit of need at this point, I believe, because some of those things have been ignored in past years, or family needs support and didn't know where to get support from. So the school is the first line of defense to help with that.
Any other questions? All right, thanks everyone for being here. We appreciate it. Have a good afternoon.
Thanks, Joe.
Thank you all.
You're welcome. Thank you.